Due to your fever, abdominal pain, and inability to have a bowel movement, as well as evidence on the CT and scope of the lower part of your colon, it is likely that you have a bowel obstruction. This can be caused by a number of things, and we can't determine the cause or solve the problem without doing an open abdominal surgery. We were hoping that by treating you with antibiotics in the tube that we put down your nose, we would be able to get rid of the infection and remove all of the built-up contents in your bowel. Because you have not responded to conservative treatment, we need to move forward with a procedure called an exploratory laparotomy. This procedure involves making an incision in the middle of the abdomen in order to examine abdominal contents. It is likely that there is a mass in the lower part of the colon. If that is the case, we would need to remove that portion of the colon and make another small incision in the abdomen. We will then pull a portion of the rectum through that opening and attach a bag for stool to enter. The risks of this surgery include blood loss, hypothermia, which is a body temperature that is too low, complications from anesthesia, infection, and damage to the ureters and vessels that supply the gut. However, if you do not have this surgery, this portion of the bowel will most likely die and cause you to have an even worse infection. During this procedure, we found an abscess in the small intestine and sigmoid colon. We were able to drain the small intestine abscess, however, the sigmoid colon had to be removed. We did create the colostomy, the bag which is attached to your abdomen. We are unsure whether we will be able to reverse that or not. You most likely developed these abscesses due to diverticulitis. This is a condition where the outpouchings of your colon that we saw in your colonoscopy can become infected and inflamed. If left untreated, these diverticuli or pouches can develop into an abscess. We will keep the tube in your nose to suction out any remaining abdominal contents or infection, and we will have you remain in PO, not eating or drinking, for the next 24 hours. We will continue to monitor you in the hospital and will assess for discharge when you have completed your course of antibiotics.